Hello and welcome to the Can I Retire Now podcast with your hosts, Nick Russell and Becky Wagner. I'm your podcast producer, RJ Malik. Right now, here is Nick Russell.
Thank you, RJ. So exciting for me today. So for those watching, as opposed to listening, you are not my wonderful, beautiful wife, Becky Wagner. You are in fact, you look a little different. You're my good friend, Dr. Ara Suppiah, who was gracious enough to lend me some time to talk a little bit about some of the stuff you do professionally, how that affects people and could affect my clients as they age, and health and well-being. And I talk to clients a lot about this, where money isn't everything, right? For a lot of financial advisors, we just talk about money, money, money. But you can have all the money in the world if you're not able physically to take care of yourself and be able to take advantage of the money you've saved and earned and all of that. Is it really worth it? So I'm going to take a moment to introduce you to all of the listeners. Okay. Your CV is impressive. So I'm just going to read it right off what I grabbed here, which is so Dr. Ara Suppiah, you're a physician, innovator, global expert whose life story embodies resilience, reinvention, and relentless pursuit of excellence. You were born in Malaysia. You were a junior tennis player, right? You earned a scholarship to study medicine in the UK. You graduated in 95. You've, of course, now been all over the globe. You were in one of Australia's top trauma centers. I don't think I even knew that about you.
I trained in the Alfred in Melbourne Hospital to learn trauma there, yeah.
Wow. Okay. And now you work with a lot of athletes and professionals. You're also an ER doctor here, an assistant professor at UCF.
Yeah.
And just some of the career highlights, which we had some fun going over here in the office before you got here. You have supported 7 world number 1 golfers who have contributed to 35 major championship wins. You guided 14 athletes at the Paris Olympics, and they won 3 medals, 2 gold and a bronze. I didn't realize this either. You've helped both the European side and the US side for the Ryder Cup teams. Yeah. You're the head medical services for the Live Golf leadership. And you have been a medical analyst on NBC Sports Golf Channel, chief medical contributor for Golf Digest. And you've been featured on CNN, BBC, CBS, USA Today, and now on Can I Retire Now?
There you go.
Wow.
There you go. Top it all off.
Just check. Now you're done. Perfect. So, that is it's a high bar for any future guests that I have on the show.
Yeah, no, really, no.
But it's but all joking aside, I mean, I've known you for probably about a decade now. I love your approach with working with patients and everything you've shared with me, and so much so that prior to recording this, we were in another room. And I hired you to take my blood and run labs and do all this stuff. So
I made you pee in a cup.
You made me pee in a cup first thing when I got here in the office, which was not what I was expecting. But hey, we got to make sure that I'm in good shape.
You wanted to be checked out.
I thought, why not live the experience?
Absolutely.
So I want to start with what functional sports medicine is and this functional sports medicine matrix, just to give people a little bit of background in. How is your approach, as someone who's also an ER doctor, how is your approach different, aligned, not aligned with what people think of when they think of, I'm going to get some labs run, I'm feeling a little sluggish,
Yeah. So, gosh, such a big topic. Okay, so let me start by saying this, right? I've trained formally in England. I went to medical school in Liverpool University. Then I trained as a surgeon. I didn't like it. Then I swapped to, I worked in the intensive care for 18 months before moving on to be trained in emergency medicine, which I discovered when I did surgery and loved it. Even till today, it's oxygen to my soul. Walking to a chaotic ER room is I go completely calm and everything is in slow motion there. It's weird. And then during that time, I discovered sports medicine. I trained in sports medicine. And I started working, I started working with golfers predominantly because I was a golf addict at that point. And lo and behold, having done all this formal training allopathically, I would work with these athletes and they would say to me, Doc, like, my allergies are bad all the time. And I was like, oh, take antihistamine. They're like, yeah, I've taken everything. It's still bad. Or they'll say, I'm tired all the time. Or they'll say, hey, like I fly, I got to go compete in China. I get there on Tuesday. And then, Thursday, I got to tee it up at, 8 o'clock in the morning. My body's all over the place. I'm still jet lagged. Is there a way to recover faster? And what I realized, like, a lot of the training that I did was to treat medical conditions, right? And I think we start the conversation there. As a traditional physician, when you go to medical school teaches you how to treat disease with pharmaceuticals.
Yeah.
I was never taught health.
Yeah.
Not once.
When you hear that,
Yes.
it's kind of shocking,
It's baffling.
right? But I feel that way. I feel like when you go, and I talk about my mom a lot, but my mom even just said this the other day. She feels like if she goes to, my knee hurts, I go to an orthopedic, they're going to recommend surgery because that's what they know.
Oh, yes.
Or injections, right? Like, hey, you have a problem. This is how we treat it. That's it. But it's not, how did you get that issue?
Yes, you've gone to a specialist who's been trained to diagnose disease and treat disease in very, in a very specific manner, like limited ways, pharmaceuticals, surgical intervention, injections, that way, right? Yeah. It is unfair to expect that person to know health or know a whole bunch of things. And yet, as physicians, we are responsible, or patients hand over their health to us. We know nothing about health. And the absence of disease doesn't equal health.
Right? The absence of disease does not equal health. Yeah. Okay.
I know many, many Olympians who are diabetics, asthmatics, right? So-called have an illness, who are Olympic athletes. And I know many people who are no medications, completely healthy, who can't climb a flight of stairs without getting out of breath. So if you want to understand and study health, you have to go study health. And so when I started working with these athletes, that shift happened, and it dawned upon me, like, I have not been trained to study health.
It's the first thing that comes to mind when you say that is nutrition, because it's food related.
It's more than that.
But like, what I guess
so
comprises
you start off by saying what makes someone healthy.
Okay.
If you look at ancient wisdom, health is the ability to really to think clearly.
Okay.
To have a body that can function to do whatever it needs to do, right? The energy to do that, and the ability to recover from all of that, which is the ability to sleep soundly, right? Part of that process is creating energy, eliminating toxins, having an immune system that's robust so you don't get sick, have a skeletal system that works, have all the hormones in the body working so that you feel great, right? And then a brain that puts all of that together. So that's fundamentally, in a very simple manner, like that's how you got to approach health. Okay. So I went on a journey to study health. And along that time, I discovered a whole variety of things that I was never exposed to in medical school. Root cause medicine, which is functional medicine, understanding this very simple concept of it's not as important to know what the diagnosis is in a person as much as it's to know who is the person with the diagnosis.
Okay.
In medical school,
what is going on with that person
that
has that issue?
Correct. Okay. What's going on with that person? Why did they get this? Right? So from there, with bringing to athletes, I ask 3 questions whenever I have any condition, any athlete. Why this athlete? Right? And you can take this to any, like, why this person? Why this illness? Why now?
Oh, okay.
Okay. So you talked about your mom. Okay. Her knee's flaring up, right? So why does your mom have a knee issue? Why is it not a hip issue? Why is it not the other knee? Like, what's unique about your mom that made that knee painful, right? Let's say the diagnosis is arthritis. Okay. Well, why does she have arthritis in that knee? What is unique about her? Why did she get arthritis? Why did she not get, bursitis or a whole bunch of other conditions? And then what's going on now that's made this flare up? Because this condition's been there for a while. What made this flare up right now?
Let me play doctor for a second. Oh, because she's old, or she's got aged, or because she doesn't move around as well. Or I think those are kind of like the throwaway answers that I feel like you would get from I'm not just saying for medical professionals, but from just people in general, or even in myself.
Yeah.
Like I had you, I heard you to run all my labs and go through this process. And one of my big complaints is lack of energy.
Yeah.
Like I feel tired a lot more than I feel like I should.
Yeah.
And I'm one of those people, like you said, I don't have a medical issue that I'm aware of, fortunately, and don't take medications or anything like that. So why? And you have people give you answers, especially nowadays, social media, everybody's got an answer, right?
Yeah.
And maybe it's nutrition, maybe it's vitamins, maybe it's this, maybe it's that. But I like the idea of thinking about why now.
Yeah.
That's the part of that really stuck out to me.
Yeah, that's really important because
I think we take for granted that it's like, oh, well, I'm aging. So these things.
Yeah, but even if you're aging, right? Why did this not happen a week ago, a month ago, a year ago? What's happening now? Did you age a little bit faster? Did you put on a little bit more weight? Did you do extra work? Is the bone spinning down? See, you know what I mean? Like, okay,
I felt personal.
What
felt very familiar right there.
Good.
Yeah.
Good. So like I look at it from a more holistic manner.
Yeah.
Right. The approach I have, like functional sports medicine, right? I look at how the body functions to compete in sports. Okay. So, I look at, the if you look at the matrix we talk about, fundamentally, chronic inflammation, which is like, think of like chronic, like a slow burning fire, right? That slow burning fire. It's going on all the time. In athletes, when that fire gets a little bit out of control, when it burns a little bit hotter because of their lifestyle, because of their training, because of their workload, whatever it may be, their ability to train and absorb that training and their ability to recover from that training goes down. They're not able to train as hard and recover as well, right? Which means they're less resilient and more likely to get injured and less likely to compete and perform at the highest level. Okay? So my job is to dampen down, bring that fire back down again to a much more manageable level.
And it's okay to have it.
It's always
like
there.
Normal there.
So this word inflammation sometimes gets a bad rap. Acute inflammation is absolutely essential. You will die if you don't have acute inflammatory response. Okay.
Can you explain?
Like I did your bloods this day. I punctured your vein. We took the bloods, right?
Yeah.
That healed up. Because of an acute inflammatory response.
Oh, okay.
So if that doesn't happen to you, you would die.
Yeah.
Your immune system won't work. Like you will just collapse. Okay. So acute inflammatory response is absolutely necessary. But it becomes an issue when it becomes chronic inflammation. So if you look at, what drives cancer, coronary artery disease, strokes, diabetes, obesity, autoimmune disease,
which you've just rattled off, what has to be 5 or 6 of the top
6 conditions, right?
Issues. Yeah.
Childhood disorders, ADHD, depression,
really,
anxiety,
all related to inflammation.
All of those have chronic inflammation as the driver. So when you study root cause, that's usually like that. If you can reduce that, like take diabetes, obesity, hypertension, right? If you can reduce chronic inflammation, a lot of that will get better. Insulin resistance is a response to chronic persistent inflammation.
See, and it's interesting to me because if you hear someone's obese, they got to go on a diet.
Yeah.
Now,
but if you don't address
the inflammation issue, it's still
you're still gonna struggle.
And so where does this inflammation come from?
Perfect. See?
Yeah.
That's why you're running the show.
Oh, hey. All right. Look at me.
So then I got to go, okay, where's this inflammation coming from?
Yeah.
And for simplicity's sake and for the sake of being able to test and reproduce the results and retest, it comes from your energy pathways which is your mitochondria, like one of the big source of that. It comes from your immune system, which 70 to 80% lives in the gut, in your belly. Okay. Comes from your ability to remove toxins or detoxify, your detoxification system. Comes from your hormonal pathway, which also involves the brain chemistry. So we look at thyroid, testosterone, cortisol, sex hormones, and then you look at the brain chemistry as well. And then comes from your skeletal system.
What is that?
Skeletal, that's your skeleton.
Oh, your
joint.
skeleton.
Yeah,
Oh,
your
okay.
skeleton. So
Oh.
if you have asymmetry, then one joint is going to wear out more than the other, especially if you are active, right? And that causes pain. Pain then has a profound effect on the whole body. Okay. So chronic inflammation comes from these 5 areas, but also affects these 5 areas. So let's say you have chronic pain, which then causes it's a chronic inflammatory response. But now, because the chronic pain, you don't sleep as well. That alters your thyroid hormone. That alters your testosterone. Okay, which then affects your immune system because you're not sleeping as well. It's a whole thing. It's all connected.
Wow.
So although we study the parts in isolation, what I do is, with functional sports medicine, I look at an athlete, and they normally come to me either because they are good and they want to stay good, or they come because they have a problem. In either case, if you're good, I'm like, why this athlete? Why is he good? Why is he good now? Is he going to be good for a long time?
Yeah.
That's how I work, right? And so I would run blood, urine, stool, saliva, hair analysis, and get a dashboard, just like what you do. You collect all the numbers.
I was going to say, this feels so oddly familiar to what I do. And you used one of my favorite words, which was holistic, because I feel like when people come to see a financial advisor, they'll usually go, oh, you're the investment guy.
Yeah.
And investments have a big role in your saving for the future, wealth accumulation, retirement. But if we're not also looking at your insurance, your estate planning, your cash flow, debts, education goals for kids, all those other things, because they all
the stuff you've done
affect each other. And so if you're making a lot of money, but you're paying a ton in taxes and you could lower your tax rate, that means there's more net money in your pocket.
Yep.
And people don't even think about that. They just think, oh, I want to make more money in the market. So taking a very holistic approach.
Yeah, this is exactly the same. So we collect all that data and then use that data to answer those questions.
Okay.
Right? And then address whatever problem we have. And the way I do it is, my goal is to drive down chronic inflammation and figure out, okay, which, and also, when you go and speak to someone and you say, I need you like completely cut out red wine. They may not do it. It's a battle that they don't want to have. So I would say, okay, you know what? Here are 5 things you need to do. Blah, 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 blah. You pick one thing that you're going to guarantee me you're going to do consistently for 6 months.
It's a good approach.
Yeah.
Because by the way, I'm the opposite. I'm one of those people where, and I think I've shared this with you years ago, I was having a lot of health issues. This is now 15 years ago or so. And GI issues, and I wasn't sleeping, and it felt weak a lot, and autoimmune. It was just really bad. And I went to every doctor on God's green earth, and thankfully, I don't have a thing, right? I didn't cancer.
You don't have a disease.
I don't have a disease, but there's something.
And you lack vitality.
Oh,
see,
don't tell Becky that. That just
you lacked
vitality. Yeah, and I'm much better now.
Yeah.
And what the approach I took was solely food based. Was nutrition. I realized that when I ate meat, red meat specifically, I got sluggish and I wasn't sleeping well. So I started cutting that, and I felt better. And that helped. Now, I had no idea what I was doing.
It doesn't matter,
right? But
your intuition and your instincts and your willingness to experiment got you there anyway.
Yeah, but when you say like, get rid of this, if you told me today, like, here, I have the results of your blood work, you can never eat peanuts again.
Yeah,
fine. I love peanuts. I'm never going to eat peanuts again.
Yeah,
if that means I'm going to live healthier, longer,
but not everybody is like that.
Yeah,
and that's what I've come to realize. Even athletes, you think like they're the most no, they're not. They're horrifically undisciplined. A lot of them, right? undisciplined.
Well,
Because
yeah,
what is discipline?
yeah,
Like what, that's judgment calls, right?
yeah,
What I've come to realize is, with a lot of this, 100% of doing one thing, committing to one thing is better than, 10% of doing 5 things badly.
yeah.
It doesn't work.
But jack of all trades,
Yeah, it
master of
doesn't.
none.
So I say to them, I said, listen, you asked me this earlier. So the solutions always start off for me, lifestyle. Okay. So what's your sleep like? What's your movement like? And again, I don't use the word exercise, movement, right? And then what's your diet like? What's your nutrition like? What's your hydration like? And then what's your emotional state like? Who are you around? Is it toxic? Is it empowering? Do you have time for yourself? Are you an introvert? Are you an extrovert? How do you energize as a person? Like all of that goes into it, right? Then you can look at supplementation to address whatever else that you need to do.
Like if you're talking about vitamins and things, if there's deficiencies.
Vitamins, yeah. If you need something to help you sleep better.
Okay.
If you need to listen to white noise, that's good.
I was going to say, but you're not talking about like sleeping pills.
No.
You're talking about like
actual supplementation.
environmental
Yes.
thing. Okay.
So it may be a herbal tea.
Okay.
It may be, using adaptogens. It may be using background noise. It may be using stim. It may be supplementing whatever lifestyle things that you're lacking, right? It may be massage. It may be essential oils. It may be any one of those. So supplement is not just what comes in a capsule.
Which is, I think, what we think of. Like when you said supplements, I immediately thought jar of vitamins sitting on the counter.
No, supplementing whatever else that you need, which you can't get here, right?
So can I ask you like the $1 million question?
Yeah.
How come if I go to a GP, we don't have conversations like this?
They're not trained in it. Like, they don't have time. Look at this podcast. This time that I've been here, a GP would have seen 3 patients.
Yeah. Is that you think, because you've been around the world, you think that's a uniquely Western medicine, American approach of?
No, I think it's the population has gotten sicker. Certainly after COVID, a lot of doctors, GPs, especially retired. So the volume has gone up, and the demand for the consultations have gone up significantly, and wait times have just gone up. And it's just supply and demand. Part of it is also, reimbursements. If you run a practice, you need to make a certain number of money, like it's a business ultimately, and you have to see a certain number of patients. We don't want to think like that, because doctors have always traditionally been like people who cared for caring, and we still are. But how do you pay for your car? How do you pay for the practice? How do you pay for your insurance? How do you pay for? It costs you $120,000 to $200,000 or $300,000 to even start
to exist.
To
right?
exist.
Yeah.
To provide care.
And I consult with other advisors and coach, where I say it's the same thing here. Yeah. My number one desire to being a financial advisor is helping people.
Yeah.
Very aligned with medicine. I want to help people.
Yeah.
But if I go to try to help more people, there's only so much of me to provide. So I have to hire staff or hire other people and find different ways that we can continue to see more people and make a bigger impact.
Correct.
And like you said, I still have salaries to pay and rent and this and that. And it's,
yes, you can hire nurse practitioners, you can hire, PAs and all this kind of stuff. Cutting the consultation time to me just doesn't feel right. Like, that's not a compromise I'm willing to make.
Yeah.
So I can't speak for other people. I can only speak for myself. I've been blessed to be brought up and trained by some of the most amazing physicians on the planet. Like, literally, Nick, I cannot, it would be a slap in their faces if I don't do right by them. And so for me, you know what, like, I take the time. And so I don't work in those settings. Even in the ER, like, I'm told I got to see a patient and discharge them by a certain time. And I'm like, according to who?
Yeah.
Who made this rule? Now, I understand patients shouldn't wait willy-nilly for lots of reasons and blah, blah, blah. But don't give me a time to say how much I have with a patient. some made up arbitrary number. Like I don't understand that. But unfortunately, that's the world we live in. Reimbursements for doctors through insurance, all of that is tied to points that you need to hit. Okay. And so the consultations are very short. So imagine a doctor, like 10 minutes. You go and say, I don't feel great. I feel like low in energy. They are not trained in health.
Yeah. That's still such a shocking.
They're trained in disease, right?
Yeah, the way you say that.
So they have to think, okay, I got to make sure he doesn't have a thyroid issue. I got to make sure he's not anemic. I got to make sure he's not blah, blah, blah. This kind of stuff, right? Okay, Nick, how long has it been going on? Blah, blah, blah. And then off you go to run labs. Now, I give you a script. You make an appointment with the lab, which takes 2 weeks. And then it takes another 3 weeks to get an appointment to see me back again. And I see you and I go, your labs look great.
But I still feel like crap.
Yeah, how's your sleep?
Yeah.
Are you sleeping okay? Blah, blah. And then just, are you depressed? And, and at some point, the doctors get stuck. They can't go any further because they haven't been trained to do all the things I just described.
Yeah.
Which is not fair. Like, they've not been trained in that.
I use this as a example. Tell me if this is too crude of an example. I feel like when I go to the doctor, if I don't have something like a broken arm, where they can go, your arm's broken. Like, I can see it from here. It's broken. Let's go ahead and treat that. Let's go fix that.
Yeah.
It's tough.
It's tough.
A lot of people, I know if you listen to like the side effects of medicine when the commercials are on TV or anything, everybody's like, are you fatigued? Are you stressed?
Yeah.
Every time I go to the doctor, they ask like, oh, do you feel stressed? And
Yeah.
I'm like, and I've always been taught that stress isn't necessarily a bad thing.
No, correct.
There's good stress, there's bad stress. And,
Yep.
and of course, a financial advisor, we tend to usually fall on those top 10 lists of like most stressful jobs stuff. But I love what I do. And I rarely feel negative stress
Yes.
in my day-to-day life.
Yeah.
And I have to thank Becky for that and my work environment for that and my clients for that, who are wonderful. But that's like the go-to. Are you stressed? Are you depressed? I get asked if I'm anxious or depressed
A lot.
every time I see the doctor. And I'm like, I walk in with a smile on my face. Other than this pain in my side, I'm doing great. Like, come on, what do you mean?
It's
important to ask.
It's important to ask.
But-
B, it's very, very common. And C, that oftentimes answers a lot of things that goes on with people, So, yeah, I think it is the state we are in.
Yeah.
And I think they do a phenomenal job.
Yeah.
With what they have and the expectations that are put on them. Is it ideal? No. Which is why I have a thriving practice. And again, I chose a path that wasn't normally taken.
Yeah.
And I chose to like not be this way. And I wanted to, I don't have an office. I work with my athletes one-on-one. I know all their families. I know where they live. I go to their house. Like, I come to your house. I draw your blood.
You know Becky. Yeah.
I know Becky. Like, it's because I want to see the animal in its environment. Because that will tell me everything.
Yeah.
If a guy has or a girl has, 3 young kids running around and they've been traveling for 3 weeks competing, the amount of guilt they feel leaving those kids behind?
Kids, yeah.
Now, that is an additional level of stress. That unless you know that and appreciate that about them, when their allergies get bad or they get an injury or they get colds, people think it's unrelated. It's not. It's all related because guilt is a huge stress on the system.
Yeah.
Loneliness is a huge stress on the system.
I was going to say, because as I brought up like depression, anxiety before, like I know people who have, I don't know if they have a chronic issue, they chronically feel just not themselves.
No.
Right. And they're the same people that maybe are a little sad or a little stressed or anxious about stuff.
And that, so I run that practice. And so I don't have patience. Like, I have relationships with people who I look after, and that's taken years to develop. So, fundamentally that's my practice. It's using function. I make the body function and look at function, how the body functions, and maximize function for sports. So,
and for financial advising.
And for financial advising. There you go.
Yeah, I was going to say.
So,
So for anybody who's listening, I'm not training for anything.
Someone asked me recently, they said, what is it that you do? And I when I go to like when I get invited to talk and lecture or speak in keynotes or whatever and podcasts or whatever, it's so much easier when someone else does the bio and the introduction,
Yeah.
because I don't have to say it.
Yeah.
Because I don't even know where to start. Like it's so bizarre.
Yeah.
Someone recently said, "What is it that you do?" And I was like, I make Ferraris go faster.
Okay.
That's what I said. And now I think I'm going to think.
How about Pintos?
Yeah,
What can we
Pintos,
do
yeah.
with Pinto?
Pintos.
Can you
So on that,
refill me?
listen, on that thing, right? Here's a really good way to think about this, right? If you're driving your car and the engine light comes on, you take it to your mechanic. The mechanic's really good at figuring out what that is and fixing that, right?
Yes.
But if you take it to the same mechanic and say, nothing's wrong with my car, I just need you to make this car go faster, most mechanics cannot do that. You have to have a very specific mechanic who can make that car go faster.
It's a really good example.
So when you go to your doctor and you say, I don't have anything wrong, I just want to live longer and feel great, the engine light's not on.
Yeah.
That mechanic goes, I don't know what to do with this. I was trained to know what to do when the engine
There's
light
something
comes
wrong.
on.
Yeah. It's my broken arm example.
Right.
If you walk in, you go, yeah, I can see it's broken.
Great.
Yeah.
We are really good at it.
Yeah. I like that. So,
there you go.
So yeah, that's awesome. So that's a really good base and made me think of like 800 different questions that we probably don't have time for today. Thanks for listening to the first part of my conversation with Dr. Ara Suppiah. Stay tuned for future episodes where we continue the conversation.
Thanks, Nick, and looking forward to your next podcast. And thank you for listening to today's Can I Retire Now podcast. Until next time, for Nick and Becky, I'm RJ Malik.